All right. Thank you, everyone, for joining us for the first presentation of the first ever National Coalition of Promise Zones 2020 Federal Convening. This is going to be a great virtual opportunity to attend many presentations, this being the first one, that will provide an opportunity to hear from federal agencies, change agents, and other leaders on an array of topics. So thank you for joining us. My name is Julius Austin. I am the Sacramento Promise Zone Coordinator for the Sacramento Promise Zone, and our lead agency is the Sacramento Housing and Redevelopment Agency. I'll be hosting for today, but I have a wonderful co-host, Jake in Minneapolis, and he'll announce himself further. But without further ado, I would like to announce a great welcome from Holly Kelly, who has a very lengthy title, but I'm going to try my best to share with you who Holly Kelly is. Holly Kelly is the Director of Community Engagement for the U.S. Department of Housing and Urban Development, Office of Field Policy and Management. How did I do, Kelly? Holly Kelly.
You did fantastic, Julius. You probably do it better than I do. Quite honestly. Well, good morning. Hello, Julius. Hello, participants. Hello, HUD in the field. Again, my name is Holly Kelly. I'm the Director of Community Engagement for the U.S. Department of Housing and Urban Development, Office of Field Policy and Management, Field Operations. My team and I work on a number of initiatives that promote and support a community sustainability across the country. And one of those initiatives is the Promise Zone Initiative. As you all know, as well as I do, Promise Zone Initiative is an important effort that HUD, along with its partner at the U.S. Department of Housing, U.S. Department of Agriculture, I should say, have administered since its inception approximately 6 years ago. Communities across the country designated as urban promise zones continue to address important issues and challenges particular to their geographic area, such as affordable housing, quality education, safe communities, accessible to quality food, and others. We partner with organizations across the federal portfolio, along with state and local government and private and philanthropic organizations, to continue to support Promise Zone designees as they carry out this incredibly important work, and we truly appreciate that continued support. To that end, HUD is pleased to work with the National Coalition of Promise Zones as we advance the Promise Zone Initiative. And so on behalf of Mr. Benjamin DiMarzo, the Assistant Deputy Secretary for the Office of Field Policy and Management, and the entire Promise Zones team, both in headquarters and in the field, we wish you best wishes on an incredibly successful event. And please remember, most importantly, if there's anything that we can do to further assist you in this effort, don't hesitate to use the contact information that I'm sure will be provided to you, and don't hesitate to contact us. Thank you. Have a great event and have a great rest of your day. Thank you so much. Back to you, Julius.
All right, thank you so much, Holly. We appreciate that wonderful welcome. And so without further ado, we are going to get started with the first presentation, which once again is transportation and mobility to support access to opportunities. I will be turning over the hosting duties and the moderating duties to Jake in Minneapolis. He will introduce himself and also share a little bit of logistical information so that we can make it through this presentation without any hiccups. And then he will be announcing our esteemed panel. Jake?
Thanks, Julius. Hey, everyone. My name is Jake Akrovic. I work for the U.S. Department of Housing and Urban Development, and I'm the community liaison to the North Minneapolis Promise Zone Initiative up here in Minnesota. You know, when the Coalition of Promise Zones started organizing this event and they asked folks to help moderate the panels, I was really excited to see that there was something related to mobility, transportation, and transit, because one of my first government jobs was working for the Minnesota Department of Transportation for a few years for their research and policy office, policy analysis office. And so that was kind of my entree to transportation, transit, mobility related issues. And so I've always that still holds a place in my heart. You know, second, when I was growing up in a small city, Duluth, Minnesota, we didn't have a car. We had to walk around, bike around, take the bus. And so, you know, mobility is something that I always think about when I go back to the times before we moved out to a more rural area and had to buy a car. And so I know that there's a lot of challenges around folks of different demographics, you know, needing access to opportunities and mobility. And there's a lot of those challenges in the Promise Zones and in other places around the country. So without further ado, I'm going to go back to my handy dandy cheat sheet here and talk about a few housekeeping items. One is the reminder that the session is being recorded. Two is a reminder to please remain muted. We're taking questions in the chat box, so Julius and I will be monitoring that chat box for questions. And what we're going to try and do is short Q&A after each individual session, and then at the end of all the sessions, time permitting, we'll go ahead and do a broader discussion or Q&A. So we'll see how much time we got left. We are the first session in this series of roughly 15 sessions, and so apologies in advance if we're working out any glitches, but I think it's rolling pretty smooth so far. So as Julius had mentioned, what we're talking about today is transportation and mobility to support access to opportunities, and we have three really great and experienced panelists. We got Susan Weber from the U.S. Department of Transportation, FTA, Federal Transit Administration. We got Judy Shanley from the National Center for Mobility Management, and then we'll have Matt, we didn't cover this one, Matt Schreifer or Schreifer. I don't know if it's the E or the I.
It's Schreifer, you got it right, perfect, thank you.
From the Evansville, Indiana MPO, Metropolitan Planning Organization. So with that having been said, I am going to introduce Judy Shanley, PhD. Let's see, where did I? Oh, sorry, Susan, you're up first, aren't you? My bad. I messed up the order of the bios. Susan M. Weber is a community planner with the U.S. Department of Transportation, Federal Transit Administration, or FTA, out of the Region 5 office. She has over 25 years of both public and private sector environmental and transportation planning experience, successfully assisting a variety of agencies around the country in analyzing and recommending feasible and cost-effective improvements. This multimodal experience includes accessing capital and operating costs, environmental justice issues, socioeconomic, and impacts to the human and natural environment. In her current position, Susan provides TA to technical assistance to FTA grantees. This entails working with the Office of Planning and Program Development, doing planning, environmental and grant development work in Region 5, which is the Midwest region. In this capacity, Susan assists, coordinates, and negotiates with representatives of state and local governments, transit operators, and local planning agencies on complex transportation planning and programming issues in Michigan. She has also worked in 5 other states in Region 5, which include Ohio, Wisconsin, Minnesota, Indiana, and Illinois. Susan earned her master's in public administration from the Maxwell School of Citizenship and Public Affairs at Syracuse University, and an undergraduate degree from Indiana University's School of Public and Environmental Affairs. Whew, that is a mouthful. So she's obviously qualified for this presentation. Let me see if I can figure out how to get the presentation up, and then we'll get rolling. We're almost there. Ta-da. All right, Susan, I'm ready to go when you are. Just if you just want to say next, then I'll advance the slides when you're ready.
Sure. Thanks, Jake. I appreciate that. Good morning, everyone. It's great to be here. This is just our introductory slide showing the 3 of us that are presenting on this transportation and mobility to support access, myself, Judy, and Matt. And I've had the honor to work with the 2 of them on many projects and presentations. So you can just move it along. The next slide is just my cover slide. What I'm going to be talking about is CCAM, which is the Coordinated Council on Access and Mobility. It's and we're going to talk a little bit more about that. So we can keep on moving. This is just my quick agenda for this morning's. I'm going to talk about the CCAM strategy, some of the initial work and most recent work we've done, and then some opportunities for us to all stay connected, because really what this boils down to is just partnerships and building those relationships. So the next slide, you can move forward from that. So not sure if you have all heard about CCAM, so I'm just going to give you a little bit of history on the organization. So it was established in 2004 by executive order by President George W. Bush to improve the federal transportation coordination. There's a lot of federal dollars that get spent on transportation. And it was CCAM, the Coordinated Council on Access and Mobility, was charged with improving the availability, accessibility, and efficiency of transportation for three populations that are underserved: individuals with disabilities, older adults, and individuals of low income. So the Secretary of Transportation chairs the CCAM, and then there are additionally 10 leaders from other federal agencies that make up the membership of CCAM, and there's the organization chart there. And we can go on to the next slide, please. The FAST Act is the Transportation Infrastructure Bill, Fixing America's Surface Transportation, and that was signed in December of 2015, and President Obama recognized the importance of reliable surface transportation nationwide, and including improved access and coordination for efficient transportation. What the FAST Act did was to specifically require CCAM to improve the federal coordination. Some of you may have heard of the former organization called United We Ride, and that was the precursor to CCAM. So we're just building on that work and continuing to move it forward. So if we can move to the next slide, please. So CCAM adopted a strategic plan, Mobility for All, in 2019. And what I'd like to do is kind of go over the 4 major goals that are highlighted on the slide here. And the first was to improve access to community through transportation. And we all know how important this is for individuals of disability, older individuals, and those of low income to have the opportunity to access jobs, education, healthcare, and what it does too is that when there's improved access to healthcare, it reduces more serious health problems later and reduces the overall healthcare cost. So that's our number 1 goal. The second goal was to enhance the cost effectiveness of coordinated transportation by promoting equitable cost sharing and consistent reporting, and trying to reduce barriers and encourage federal funding recipients to share resources with one another. Sometimes we run into that struggle of not having the ability to do that. So we're going to talk a little bit more about that too. The third goal is to strengthen interagency partnerships and collaborations with state, local, and industry groups. And we'd like to, continue to build on the success that CCAM has had, and continue to strengthen those partnerships and be able to respond to real-time needs that are out there that we know are really prevalent, and especially in today's operating, the world we're operating in right now. And lastly, the fourth goal is to demonstrate innovative coordination of transportation. There's, a continual change in the development of technology. It changes you know, daily probably. And so we'd like to be able to improve the efficiency and the quality of transportation services. So that was our last goal. So if we can move along to the next slide, I'd like to then talk about some of our initial work, which was from 2016 through 2019. So our next slide, please, Jake. What this slide is highlighting is some of the recent CCAM activities. And these are going to be detailed in the following slides, so I probably don't need to spend a lot of time on this, but I will highlight some of the things that I think might be most useful to this group is the federal fund braiding guide, and there'll be a whole slide dedicated to that. But the goal of this slide is just to show you that there is a good amount of work that has been done from 2016 through 2019. So if we can move to the first slide here. So what's happened here is FTA, the Federal Transit Administration, for whom I work, has had a number of pilot programs, and the first one is the Transit and Health Initiative, and it was formerly known as the Innovative Coordinated Access and Mobility Pilot Program. And what we wanted to do was to emphasize the importance of partnerships between health and transportation providers. And so what we did, there was a pilot project and a call for projects on a national level. And what we wanted to have done was that funds had to be used for capital projects to improve the coordination of non-emergency medical transportation, or NEMT, for transportation disadvantaged populations. And so with this, we were able to fund more than 30 state and regional pilot projects with the use of over $18 million of CCAM funds. And just to highlight a few of those projects that you may have had heard about, because one is the Flint Mass Transportation Authority in Michigan. They developed a mobility management program that involved non-emergency medical transportation and trip planning and training, and it coordinates the wellness, transportation trips for patients, and urgent care for families, veterans, older adults, and people with disabilities. Flint MTA is sort of known nationally as a leader in this. So just wanted to highlight them a little bit. And they're a great resource. So moving along to the next slide, please. FTA and Judy's Technical Assistance Center, the National Center for Mobility Management, held a series of in-person and virtual focus groups back in 2018 to try to determine the top barriers to transportation coordination. And they're highlighted here. They had reached over 200 people from 22 states, and they then gathered an additional 500 people through a survey that NCMM put together. And the most prevalent barriers were the limited awareness for opportunities to coordinate, the fact that it was difficult to engage local stakeholders. Another barrier was program restrictions allowing for coordination that potentially would to restrict or disincentivize federal funding recipients from pursuing transportation coordination. Also insufficient incentives to encourage that coordination. And then limited federal guidance on how to do this, what the parameters were, and how to remain in compliance, because we know that's a huge thing. At least I know in FTA, we do what's called training reviews. So every 3 years, it's congressionally mandated that we review all of our direct recipients and ensure that they're following all of our federal procedures and guidelines. So, and there's repercussions if they don't. So clearly, following federal guidance is important. So that was listed as another barrier for providing coordination. So moving on to the next slide. Based on that information gathered, there was an inventory of programs, and what I found pretty astounding, I guess because I work for Federal Transit Administration, you would think that DOT would maybe have the most programs that fund transportation and human services transportation, but in fact, it was found that HHS is the highest. And astoundingly, there's over 130 programs that can be used to fund human service transportation. So we'll talk a bit more about that, but we can move along to the next slide. This just highlights a few of the programs that do fund transportation. And sometimes transportation is only an allowable expense if it supports the program's main goals. So if transportation to take people to medical appointments, employment opportunities, training, or education. So this inventory has a lot of information on these specific programs and includes what's allowable for transportation expenses. And what I think does is lays the groundwork to allow for that, to identify opportunities for collaboration. So that's really what we'd like to drive home here. So we can move along to the next slide, please. We mentioned this before. So this just came out, and there is a link on our website to this, and I can get that to the group, but the Federal Fund Braiding Guide, this is huge. A lot of work went into this document, but basically what this is allowing to do is to match federal dollars to federal dollars so that potentially something can be fully federally funded. And I know I work with a lot of transit agencies here in the Midwest, and local match is often a huge barrier. So this is great if this can happen. So using the graphic on the slide, a grantee providing transportation services to people with disabilities uses funds received from the ACL, the Centers for Independent Living program, is the green portion of the graphic. And that fulfills the match requirement for FTA, which is the Federal Transit Administration's Section 5310, which is the Enhanced Mobility for Seniors and Individuals with Disabilities, the blue portion. So often our grants at FTA are 80% federal, 20% local. So that's what this is showing here. And it provides the opportunity for transportation services for older adults and those with disabilities, including centers for independent living and those that would benefit from that. So that's just one quick example of how these federal programs can be braided together to allow for 100% federal match. If we can move along to the next slide, please.
Hey, Susan, just a reminder, your 5-minute warning.
Thank you. Appreciate that. In 2019, in October of 2019, our FTA acting administrator, Jane Williams, convened the first CCAM meeting since 2009. So that was huge. So 9 of those 11 federal agencies sent at least one representative, which was a huge step in the right direction for this coordination. And what it allowed us to do is to bring together all these various federal programs and begin these discussions. So there were representatives from the Administration for Community Living, which is ACL, and they presented on coordination with FTA on transportation. And additionally, the Veterans Affairs Administration shared insights from their innovative work to coordinate and provide non-emergency medical transportations for veterans, and provided a demonstration of the VA's Vet Ride technology. And so that's exciting. And then at the end of the meeting, the delegates committed their agencies to participate in the CCAM report to Congress and President. So that's huge too, so that it's not just a DOT driven, that the partner agencies are involved in that. So if we can move along, what I'd like to talk about now is our recent work. So the FAST Act, which is our transportation authorizing legislation, requires CCAM to create a cost-sharing policy for non-emergency medical transportation. So through coordination with the Department of Health and Human Services and DOT and the Department of Veteran Affairs, we developed a policy statement on this for cost sharing. And it's a resource that our FTA grantees can use to provide key information on two types of cost sharing arrangements. One is for vehicle and ride sharing, and then the second we talked about is the federal fund braiding. The policy statement is broad and it contains information that can be useful for any CCAM grantee interested in transportation cost sharing, and information specific to grantees for those specific agencies. There's vehicle and ride sharing is specific to the Department of Health and Human Services, DOT, and the Veterans Affairs. And the federal funding braiding information is specific to USDA, HHS, Department of Justice, DOT, and Veterans Affairs. So that just highlights some additional work. And then my next slide is got a little bit more information. As we mentioned, the delegates had agreed to help DOT on this report to Congress and the President. And this is a requirement. So this is actually going to be submitted this September to Congress, so and the President, and it's just going to detail the work and accomplishments that were done, and then you know, allow for feedback and ways to improve this report and continued coordination, because really what this, as I said, is all about partnerships and getting the right people connected. So I think with that, I'm wrapping up. My next slides just talk about staying connected. There's the CCAM website that's got a huge amount of information. And then there's links to some of the documents and things like that that I spoke of. And with that, I don't know if you want to introduce Judy, but she's going to talk more about kind of the nuts and bolts of actually implementing this.
Thanks, Susan. I always appreciate the discussion about how to braid federal programs and funding, because that's one of the challenges I think that we face when we're trying to get more efficient. And you know, and I also think that sometimes the transit and transportation worlds are a little bit more opaque in some ways than some of these other programs that we, at least at HUD, generally deal with. So we probably have time for a question if someone wants to ask one in between sessions here. If anyone wants to type anything in, I'm not seeing anything so far. So what I think we'll do is we'll probably just go ahead and move on to Judy. Judy, let me find your bio here. All right, Judy Shanley, PhD, is the Assistant Vice President, Education and Youth Transition at the National Office of Easter Seals in Chicago, Illinois, and serves as Easter Seals Director of the FTA-funded National Center for Mobility Management, or NCMM. She manages federal projects, conducts research, and provides technical assistance regarding transportation coordination and mobility management. Shanley convenes diverse audiences and provides professional development to align mobility solutions with the needs of all riders. Shanley also oversees Easter Seals national education and youth transition programs and brings together school, VR, workforce, and public transportation providers to support post-school outcomes for youth. Prior to Easter Seals, Shanley worked at the U.S. Department of Education, where she wrote federal grants and monitored programs to ensure compliance with federal regulations. Prior to federal service, Shanley was a principal research analyst at the Americas Institute for Research for 9 years. She earned a PhD in special education from the University of Florida and an MBA and a master's in rehabilitation counseling from Syracuse University. We got just stacked resumes here. And now I need a drink of water, but first let me figure out how to reshare the slides. Hold on, let me join here. There we go.
While you're getting that, I'll welcome everybody and thank you for inviting me. I'm talking to you from sunny Chicago, Illinois, a beautiful day out. And thank you to Jake and Andrea and others from HUD for organizing this event. I'm so appreciative of them and you for being here and thinking that transportation and mobility is really critical to your work. I'm going to be talking to you about the next steps and implementation. You heard a lot from Susan, and you also heard that I did work at the federal agency, the Department of Ed, and now I'm at a National Technical Assistance Center. And my passion has always been, how do you get all the really wonderful things, policies, practices that are produced by federal agencies, how do you get them on the ground and ensure that they're useful and ensure that the policies result in practice that can be used. So next slide, I wanted to just affirm why I'm so interested in this topic, and likely you're interested in this topic for many of the same reasons. I was a rehab counselor. I worked really hard with school districts on youth transition, and realized that the outcomes for students were really poor. Students weren't able to procure employment, go to higher ed, participate in healthcare. Housing had always been an issue, but always the underlying reason, and we know it to be a social determinant of health, is transportation. It's a challenge, it's a barrier. And so I have spent the last 12 years, I've been at the National Office of Easter Seals in Chicago, working to bring together human services professionals and transportation professionals. So we get to work with educators, we get to work with housing and employers and workforce development and healthcare to bridge that gap to ensure that individuals have access to reliable and safe and secure transportation resources. Next slide, please. I saw this cartoon and really resonated with me. You know, when thinking about how we're going to use these tools, there's a bunch of people sitting at a pretty important meeting around a board table, and there's graphics on the charts on the wall, and it looks like profits are going down and sales are going down, and this group of people around the table are saying, what if we don't change it all and something magical just happens? Well, the chances of magic happening to address the transportation challenges that our communities have is not likely. So we have to use the tools that are being produced at federally, at state, in our local communities to affect change, because magic is not going to happen. On the next slide, please, I'm sharing with you some strategies that you could use, whether you're a federal official, whether you're active in the promise zone in your community around the country. These are some of the things that you should consider when you're looking at this whole notion of coordination across federal agencies. First, undertake an inventory of what federal programs might exist. When I talk with folks, often they don't know what their counterparts at HHS or the Department of Labor, what kind of grants they have, and which of those grants could be used to support transportation. And so as Promise Zone professionals and as HUD professionals, sit with your colleagues across state agencies, across regional entities, and do an inventory. Use the program inventory that FTA produced to really develop a catalog of what programs are there and what they can pay for. Look at their grant programs. When I provide technical assistance at the local level to people, I sit at your community meetings and talk about the grant programs that are there, and then go back to the program inventory and see whether those can support transportation. Develop a sort of checklist. If you've got opportunities in your promise zone to convene transportation and transit-related people, develop a checklist of all of those inventory programs to educate others. And Susan talked about the survey that we did nationally, where we surveyed and we interviewed federal agency staff, including HUD staff across agencies. And one of the things that we learned is people weren't aware that these various federal programs could support transportation. And so use the program inventory as sort of a checklist for engagement. The other thing is, think about projects that you mutually can put into place, whether it comes directly out of a promise zone or out of another HUD initiative. Think about collaborative projects where, if you're administering those funds, make coordination with another federal entity a requirement. Hold the grantees accountable for doing that. Also, developing communication and informational blurbs. As I indicated, people aren't aware that these various programs can be used to fund transportation. Some could be used to actually buy vehicles. Some could be used, as Susan said, to match, used as a match, either to your program, or your dollars can be used as a match. So develop some informational materials to address the educational needs of audiences. Invite representatives of these programs into advisory roles. How many non-HUD, if you're on a HUD program grant, how many non-HUD people do you have contributing? I know the promise zones are so rich in the heterogeneity of the professional disciplines of people involved. So tap into that, maximize their expertise, and talk about their programs in terms of transportation and mobility and what they could bring to the table on those topics. And then next, you could contact the National Center for Mobility Management, and I'll be talking about that project. That's my project that I work on, and would love to follow up with you all in terms of technical assistance and really rolling up our sleeves and figuring out how we can make these connections, how we could facilitate coordination. On the next slide, I just shared with you, this is, Susan mentioned the 12 HUD programs that could support transportation. And what's really neat, at the URL on the CCAM website, you actually can do a search and find out, for instance, if the HUD Emergency Solutions Grant Program, you can find out whether that actually supports vehicles, whether that supports travel training, whether that supports vouchers for riders. So it's very interactive, very searchable, and very retrievable. And when you do those searches, take the data that you find and share them with your colleagues and say, hey, did you know that your program can support vouchers for riders, to support travel to employment or travel to healthcare? Use this as kind of a foundation for a discussion with colleagues from across agencies. On the next slide, just wanted to introduce you to the National Center for Mobility Management. We're so proud of the work that we do. We are a National Technical Assistance Center. Like many of HUD projects, we're charged with building capacity, and our work is about building capacity around coordination and mobility management. Our center, we're in our second funding cycle, so we started in 2013, and our project is a collaboration. So we're mirroring what could take place at the local or the field level. We're a collaboration between my organization, which is Easter Seals, the human service side, the American Public Transportation Association, which is a large membership organization for large transit agencies, and then the Community Transportation Association of America, CTAA, which represents small and rural transportation agencies. And so collectively, we're mirroring the kind of configuration for addressing mobility needs of individuals with disabilities, those with low income. Our collaboration and our consortium of administration of our program really mirrors what could take place at the local level. So if you don't have contacts with your APTA representative in your state, find out who your state association is and figure out ways that you can attend their meetings, you can participate in advisory capacities. There's a huge push with all this access, the coordinating council and access mobility work that Susan mentioned. There's a big push for states to better coordinate. And so organizations in states like APTA and CTA are very interested in working with those of you who represent non-transit agencies such as HUD. And we're a cooperative agreement. We're funded by the Federal Transit Administration. Susan mentioned that she and Matt and I work closely together, and that's because she's in the FTA Region 5, and I oversee the FTA Region 5 area. So I've worked with Indiana and other states in the Region 5 area for the last 7 years. So great relationship with FTA. On the next slide, I've talked about the notion of mobility management. Mobility management really is bringing all of those human service, all those transportation services together with all the types of rides that people need. And our center is charged with building the capacity, building the infrastructure to help people better coordinate. And the end goal is that we hope to empower people to live independently and advance health, economic vitality, self-sufficiency, and community. And we know that housing is a huge ingredient in that. You know, we're seeing more and more developing housing developers and communities and real estate developers and communities thinking about transportation and housing developments, access to transportation as properties are being built. So I always encourage mobility managers, and these are the folks in communities that are doing this coordination work. I'm always encouraging them to knock on the doors of the housing officials and housing development organizations in their community and learn about their needs. So if you're in a state that has a mobility management network, and there's probably 50% of the states right now have what is called a mobility management network, and you can learn about those networks through our website. Knock on their door, find out how you can access their services. They provide training, they provide resource development. They could help you identify grant programs. They could help you do this inventorying of all the FTA funded CCAM projects. So on the next slide, some of the products, we're pretty traditional technical assistance center, the National Center for Mobility Management. We've developed products and resources. We have webinars and tons of events, and we could do customized webinars for your audience. So if you're in another region, another Promise Zone region, our staff can do a webinar for you about transportation coordination and how to leverage transportation resources to support the individuals that you serve. We also have grant programs, and I encourage you to share, if you're a HUD official, share with your audiences, with your grantees, with your administrators of programs at the state or local level, information about our grant programs, because we always want representation from non-transportation audiences. And then, as I said, we provide technical assistance. On the next slide, here's a map. The way we've divided ourselves across the countries, we have staff across our 3 national organizations staffed on each of the 10 FTA regions. And as I said, I'm responsible for FTA Region 5 and 1, and my colleague who's on the call, Jerome, is responsible for FTA Region 7 and 4. So if you're in one of these states and would like technical assistance, certainly you could go to our website, find out who your point of contact is, or you could contact me and I could connect you with those people. So on the next slide and last slide is, working at the Department of Ed at the federal level and then working at the national level, I'm always amazed that when I go out and do technical assistance, how many people don't know about the many federal resources and technical assistance opportunities that exist. And mostly, the materials and resources and TA that come out of these centers are free. So why wouldn't you take advantage of them? And we're siloed. right? We are trained in our professional disciplines, we work in our professional disciplines, and so it's not often that housing people think about transit National Technical Assistance Centers, and conversely, our audiences often don't think about HUD technical assistance resources. So tap into these federal programs. Share this information with your audiences, and our regional liaisons can help you figure out what materials, what resources that come out of these centers are best suited. Many of them have grant programs. The ones with the arrows on this slide are grant programs. There's our center, the National Center for Mobility Management. NATTC is a program that has a National TA Center that has a lot of information about the Americans with Disabilities Act and the funding mechanisms that exist through FTA. There's a national RTAP program, which focuses on rural and Indian issues. And then there's a shared use mobility center, which focuses on shared rides and transportation network companies, Uber and Lyft. And then the newest center is the National Center for Applied Transit Technology, NCAT, and that looks at the technology that facilitates access to transportation. So I know Matt's going to talk to you about his experiences locally in coordination, but you have my contact information. I encourage you to reach out to us. We're ready and willing and able to support your work in any way. I applaud the work you're doing, and particularly this virtual event that brings us all together. So thank you for your time. Thanks, Jake.
Thanks, Judy. And I just want to mention that Jerome had dropped a link for the NCMM regional liaison contacts in the chat box there.
Great.
So does anyone have any questions before we move on to the final presenter, final panelist? I'm gonna ask a quick question, and then we can get more into it. I just kind of want to warm up the crowd here and get a question out there so we can have a little bit of Q&A after the final presentation from Matt. But Judy, my question to you would be, you know, my mom, I know this is, you know, we often always go back to our personal experiences when we think about this stuff. My mom is 70 and she lives in a rural area in a little split level house. And I just think the demographic shifts that we're undergoing in all areas of the country in a lot of different ways are really there's opportunities and there's a lot of challenges. You know, there's a huge backlog of just regular transportation, transit maintenance and projects at all federal, state, local levels. I'm just curious for your quick thoughts on aging in place and for those types of populations.
Yeah, certainly big issue, and you know, the federal home and community-based services really promulgates a notion of aging in place and keeping people out of restrictive, big congregate health and living settings. I think that in places like that, I've seen such innovation in rural areas in terms of developing organic kinds of transportation service. I was working with a community in Colorado, a very rural community, didn't have any fixed route traditional transportation, and the aging center, the area agency on aging, the disability group, the educators, the economic development people worked with the planners that were responsible for that community to start an on-demand service so that your mother living independently in a home could call and get a ride for a nominal cost. And it was ground up. That's how the service was developed. So I would find out if there's mobility managers in her community and find out what transportation options there are. And the area agency on aging in her community would also have some really great resources.
Awesome, that's great info, thank you. All right, I am going to find Matt's bio here. All right, Matt Schriefer, AICP, is a transportation planner for the Evansville, Indiana MPO, Metropolitan Planning Organization. He is responsible for directing the distribution of over $3 million in transit funding to, and I don't know what these acronyms are, so I apologize, METS, HART, and multiple nonprofit organizations that provide transportation in the Evansville-Henderson region. Matt also helps coordinate the efforts of the public, private, and nonprofit providers to advance regional transportation options. Matt holds a Bachelor of Urban Planning and Development from Ball State University, Before coming to the MPO, he worked at Lockmuller Group for 12 years, completing and updating comprehensive plans, downtown revitalization plans, and zoning ordinances for communities across southern Indiana. When he's not at work, Matt spends his time trying to keep up with his 2-year-old daughter.
All right, thank you, Jake. I will get into the acronyms here in a little bit during my presentation. As Jake said, my name is Matt Schrieffer. I work for the Evansville MPO. And we're going to go over a little bit about the steps that we have taken here in Evansville to improve coordination between the multiple transportation providers in southwestern Indiana and western Kentucky. So next slide. A little bit about the Evansville MPO. If you're not aware of what an MPO actually is, it is a regional transportation agency. So we work with Federal Highway and Federal Transit to distribute the federal funding within our region. And our region is a bi-state urbanized area. Evansville, Indiana is the primary city, with Henderson, Kentucky being the secondary city, and some urbanized area in suburban Warwick County, just east of Evansville. Our planning area, where we focus most of our attention, is the 3 counties, Vanderburgh and Warwick in Indiana, and Henderson in Kentucky. And we also work in two rural counties in southwestern Indiana, Posey and Gibson. The planning area total has a population of almost 300,000, and the 2 rural counties have a population of almost 60,000. Next slide. There are 3 transit operators that work independently within our region. Metropolitan Evansville Transit System, METS, is the operator within the city of Evansville. Henderson Area Rapid Transit, or HART, operates in Henderson, Kentucky. And Warwick Area Transit System, WATS, is in suburban and rural Warwick County. And right now, the only connection between any of the operators is a bus stop that is located on the east side of Evansville that connects METS and WATS together. Next slide. In addition to the 3 transit operators, we also have 24 plus other transportation providers. And this ranges from a rural on-demand service, which is the same company that operates WATS, a cultural district trolley that operates on the weekends, an access to work service that provides people with trips to jobs throughout the 5-county region, 3 providers that provide transportation for seniors and individuals with disabilities, and those are the ones open to anyone within those counties. And then there are 4 others that provide only to the clients of their service, 7 medical and Medicaid providers, 5 plus taxi operators, and I say plus on there because some of these are smaller operators and they come and go. We never really know how many we have. And we also now have Uber and Lyft operating in the region. Next slide. And so for the longest time, the silos represent the way that all of these different transportation providers had worked together. Nobody really communicated that well, and while everybody was doing great work on their own, we didn't really have much cooperation between them. But some of that started changing at the end of 2017. Toyota has a plant here in southwestern Indiana in Gibson County, just north of Evansville, and they brought in Community Transportation Association of America, which Judy had mentioned earlier, to look at regional transportation issues, especially getting people to work at the Toyota plant that is a good half an hour north of Evansville. So several things came out of this work with CTAA, but one of the easy steps, the initial steps, was nobody actually knew within the 5-county region how many different regional providers there were. We had no idea how many transportation providers there were within the 5 counties. So the easiest thing to do was we needed to make a list. Next slide. So in the summer of 2018, as the CTAA work was wrapping up, we started compiling a list of all the transportation agencies and organizations within the region, as well as several organizations that would have an interest in talking about transportation. And we created what we are calling the Regional Transit Advisory Committee. This committee meets quarterly, and every now and then we'll have additional email discussions in between if something else pops up. We have 30+ members on the committee with 23, representing 23 different organizations. The 3 transit operators are all involved in one way or another. The rural transportation provider, the nonprofit providers, the access to work provider. We have a few nonprofits that do not provide their own transportation but are involved. 3 different councils on aging, a couple of residents. We have a representative from the local Veteran Affairs. There's a couple of hospitals here locally, and so he provides some input for the veterans. A couple representatives from the local workforce office that can provide some information on access to work. Silas from our promise zone here in Evansville has attended most of the meetings as well. Judy from the National Center for Mobility Management, she kindly visits all of our meetings virtually and provides her input about regional and Midwestern and national information. And then I've continued to keep up to date with an individual from the Community Transportation Association of America after their work with Toyota, and he often attends our meetings virtually too to provide some additional information. So it's a lot of information sharing between all the organizations. Next slide. And so the goal was to, obviously, these silos of individual organizations really not communicating to each other was to change that. Next slide. There it works. All right. So whenever I started thinking about putting this presentation together, I've done this presentation before, I looked up an image I did a Google search for an image of breaking down silos. And this one just popped up and I'm like, this is perfect. We don't necessarily want to break down some of these silos. These organizations individually are doing great work. We just want them to play nice together and communicate and talk together. So that was the goal of bringing all these people together and these organizations within the Regional Transit Advisory Committee. Next slide. So the first goal of the RTAC was to develop this regional transportation guide, this list of all of the providers, and hope that it was a complete list because we know there's some that come and go. So the guide was developed with help from the committee. We have a paper guide that is color-coded by county. So if you want to know specifically who provides service to your county, you can look for the color. The brochures are available in our MPO office as well as some of the nonprofit organizations around. And then we also made an online version that is best viewed by mobile devices. So people can scroll through as they're out and about if they need to know what kind of transportation options they have. Next slide. So the Promise Zone and working with Silas here has been a big help in increasing and improving coordination with the transportation providers. I myself am on the job development and economic development work groups for the Promise Zone. And like I mentioned earlier, Silas comes to all of the RTAC meetings. So we've got a lot of information we can share back and forth. For you that don't know, the Promise Zone here in Evansville was designated in 2016. It covers downtown Evansville and some neighborhoods to the east and north, approximately 22,250 residents with a poverty rate of approximately 40%. I also want to mention that Judy, I made contact first with Judy when she came to the Federal Convening last year here in Evansville, and we've continued to keep in contact, and she's been a big help. So I encourage everyone that would like to continue to to get more information, to keep in contact with Judy, because she's a great resource. Next slide. One of the earliest efforts of coordination here with the Promise Zone had to do with a grocery store. The only grocery store within the Promise Zone, just north of downtown, was set to close at the end of 2017. And that left the 22,000 plus residents without a grocery store within close proximity. There was some just outside the Promise Zone, but not as close as the one that was there. So next slide. The Promise Zone, Silas, he had reached out to one of the TED trolley, that is the Cultural Districts trolley that operates on weekends here in Evansville, hoping that he could utilize, the Promise Zone could utilize this vehicle while during the week to provide trips to the grocery stores for some of these residents. And it worked great at first. A lot of people hopped on board and got their trips to the grocery store. But as you can tell, the TED trolley was an older vehicle, and they began having issues with breakdowns. There were times when people were expecting a trip to the grocery store and the TED trolley was just not able to make it that day. And so they couldn't go to the grocery store when they thought they were going to be able to. And as you can see in the picture, this older trolley, there's obviously not a very good wheelchair accessibility on this bus. So next slide. Working with Silas, we reached out to the Missing Pieces Community Development Corporation. They're the operators of Bridge Builders, which is the access to work transportation provider, as well as Seniors Against Fearful Environments, which provides transportation to seniors and individuals with disabilities to grocery stores and the pharmacy, medical appointments, stuff like that. So this connection allowed these two organizations to provide those trips to the grocery store. Now we have a vehicle that is reliable, that can get people to the grocery, as well as a accessible vehicle. The minivan with for the safe transportation has a wheelchair ramp on it. And they're actually looking at getting a bigger vehicle to assist in that even more in the future. Next slide. So some of the next steps regionally is to obviously continue to keep up to date on the regional transportation guide. As providers come and go, we need to make sure that's current. Sharing resources. I think it was Judy that mentioned, or maybe Susan, about possibility of sharing vehicles. And we have several nonprofits that have a very limited scope of providing trips. They just use the vehicle a couple of times a week, and they have a $50,000 or $60,000 vehicle sitting around. If those organizations in the future could work together, maybe we could have one vehicle that those organizations could share together, as long as they could coordinate that. Increasing our county connections. Our two large urban areas across the river from each other do not have a transit connection, so making that connection, as well as to the other counties in the rural areas as well. Commuter routes, that goes right along with the county connections. Is there a way to provide direct routes with limited stops between the counties? A carpool program, which is something that we had looked at in the past in the region, but it never came to fruition. Maybe this is a time to look back into it and helping get people to work. Looking beyond transit, specifically the bike and pedestrian organizations in the region. Some of these transit providers will provide to a certain destination, and maybe that sidewalk or that trail improvement could help people get to their final destination. Health partners will be big. We've got a meeting actually tomorrow with the local health foundation to see how they can help with potentially providing resources to bring more people together, as well as funding opportunities. And of course, continue working with Susan and Judy to use their resources for the CCAM and other things, because as Judy, I think, mentioned, funding is often an issue, and being able to find that local match. So if that local match was covered by another federal program, that would obviously be a huge help to the agencies. So those are the ways that we're improving our coordination between agencies here in the Evansville region. The next slide is my, there you go, is my contact information. So if anyone has any other questions or suggestions for me on how we can improve coordination, I'll be happy to hear them. Thank you, Jake.
Thanks, Matt. You know what this really makes me think a lot about is we've had discussions here in the North Minneapolis Promo Zone about COVID impacts and the fact that so many of the traditional white collar workers are now not riding the bus because they're working at home. And we have an increased need for workers in suburban areas who are working at places that like warehouses and other distribution type centers, where there's suddenly this massive increase with Target and Amazon and whoever else, you name it. And so we have not been able to solve that problem yet. We've had a few discussions here and there, but I was just curious as to, it sounds like you and Silas have had some pretty good luck with coordinating some interesting options. I'm just wondering, have you extended any of those ideas to the current circumstances?
So we've had a recent meeting to somewhat discuss the impact. We're still working and communicating with each other to try to see how everyone's doing through all this. What was interesting, I was surprised to hear in our last meeting that there's a few organizations that say, yeah, well, we're not running the buses. Our programs are shut down. We're not able to do anything. We're having to find stuff for our other drivers to do. And then we have another organization that says, well, because you're shut down and everybody is having to stay home, we picked up. We're having to get people to the grocery store and the pharmacy because their normal trips aren't there anymore. So it's interesting how some have gone down, but we've seen increases in transportation need in other areas. So it's ever changing, and definitely with the way work is changing, having these conversations continue will be very helpful.
Great. So I think here's what I'm going to do. So if you have any specific questions for Matt, go ahead and type them in the box. I'm going to actually go back up to the top where we started seeing some questions. And I know Judy, it looks like Judy and a couple others have been chiming in, but I want to just start throwing some questions out for the panel. So the first one here is there any program or work being done that transit can be used to access initiating or retaining benefits such as housing, homelessness, welfare, SNAP, KTAP, Social Security, etc.? Our homeless population does not have support networks to get to the agencies 45 minutes to 1.5 hours away. And that's from Tracy Nolan, Redbird Mission.
This is Judy. Homeless individuals and their needs are included in the coordination work that mobility management professionals do. And in those places, often the HHS, Health and Human Services program people that administer those programs are in touch with the transportation providers and the professionals who coordinate service to ensure that those individuals can get to the services so they don't lose those benefits. But that certainly it's a target population of the work that we all do around coordination. So what we could do at the National Center for Mobility Management is help compile examples of other places around the country where that may be happening, where those relationships exist, and so that you could use them in your own community and replicate them. So we're happy to do that. Just reach out to us.
That's good. Another comment had come in from Karen Miller. We are in Hampton County, South Carolina, and there's no transit available anywhere. Estill, I don't know how to pronounce it, sorry, has 1,800 residents and most are seniors and low income. I have to leave the session, but if anyone here has any ideas as to how we can solve the issues, please email me. So make sure you note that one.
Yeah,
don't know.
I wanted
Yeah.
to say one more thing about the last question about services and people, homeless individuals not being able to access service. One thing that has been a recent discussion across transportation sectors is the notion of a mobility hub. And Matt and I talked about that, where you have service providers at bus stations or at train stations or at central places. I think in Indianapolis, they have a transit hub where you bring the services to the people. So if people need to get SNAP benefits or people need to check in with the Department of Labor for unemployment benefits, representatives of those agencies are at this central hub where individuals have to transfer to get a new bus or get a different kind of vehicle. So there's more community integration of services, and instead of having clients or the people that need the service go to the service providers, the service providers are in the community. And we see libraries, there's places where voter registration tables are set up, where healthcare, people can get vaccinations and different light healthcare services at these mobility hubs. And so that's what it's increasingly growing across the country. So that's one solution to address the issue of people not being able to get to a particular service. Okay. And I know Matt, I don't know whatever happened with your exploration of whether that could happen in Evansville.
It's still a work in progress. We're still working on it.
Yeah, it takes a lot of logistical coordination. People have to, you don't want agencies to think they're giving up something, but they're actually benefiting by being in this holistic model. It's like a whole family, a whole person approach to service.
Yeah.
I think that's really a critical point. One thing that I always try and bring up, and I know a lot of my partners and stakeholders do also, is that, especially if you're a middle class or higher earner, you often tend to think of low income folks as having challenges with income and other resources. But the one thing that there's also a big challenge, and again, I can think back to when I was a kid, when my mom had to drag my sister and I around to these different places, it could even just be for grocery shopping or it could be for whatever. But traveling on the bus, it takes time. And if you want people to self-actualize and get training and education and all that stuff, you got to give people more time in their day. So I think that's a really critical conversation in terms of centralizing resources.
Yeah, and it's scary. It's a scary thing sometimes to people. If you're used to taking a personal vehicle, then to use public transportation could be really scary. That's why we work a lot with youth and elementary and middle school age students to expose them to independent travel and mobility.
Great idea. Andrea from Evansville, she asked this to Judy, but I also think this could apply to to any of the panelists, is how does a community start this conversation with big employers? Yeah.
Matt, I know that your experience with Toyota, I don't know if you want to, I could talk after you.
Yeah, well, I mean, one of the largest employees in our entire region is Toyota, and luckily that was, they came to me, and so that was helpful.
And what was their impetus? Why was it compelling for them to reach out to a transportation planner?
They, I think what it was is Toyota has been looking at this in multiple regions, and having this similar issue of where they put their plants is not necessarily within the core of the population, and so while they pay pretty well. And some people may be able to afford a vehicle eventually. Some of their employees that first start out, they don't have that right now. And so how do you get those people? I know a lot of times the conversation was they would have interviews with people, and the people would just not be able to take that job because they didn't know how to get there. And so that was really the impetus of bringing somebody in to look at it regionally. We've done some studies with other larger employers. As long as the right person is asking, not me, but maybe like the mayor, a lot of times you can get those individuals to listen and come in for meetings. It's just a matter of keeping them involved in that conversation keep their interest, I guess.
Yeah, and the best solution to that challenge is not let it ever be a challenge. So when new businesses or economic opportunities are coming into a city, the economic development people, the community planning people, the real estate people that are in our community need to be having conversations and think about the transportation options. You know, I know in Chicago, and it's a very different than a rural area, but the transit people, CTA and RTA, are at the table when any new business wants to come into our community to learn whether there's options, transportation options, and it becomes a selling point and a recruitment point to get those businesses into a community. The other thing that's compelling to employers, frankly, is money. And so if employers lose money because they can't get qualified people, if they have shortages that interrupt their business enterprise, if there's you know, the financial issues of turnover, those are compelling. And in this tool, we developed a tool, and it's not on our website because I like to talk people through it. There's a tool that the Chicago-based organization developed that looks at the cost benefit of investing in transportation by an employer. So, you know, it captures data about the cost of turnover, the cost of vacant positions, on productivity, and it compares that to the cost of transportation, whether they provide transportation directly as an employer or they're part of this coordinated network where they share transportation. But it's always about the data and about the ROI for that employer. So that has to be, that data piece has to be the impetus for people to come to the table.
And I'll just add one more thing too. Our Work One office here locally, workforce development, getting them involved, they're the ones that talk to the employers all the time anyway. And so having them reach out, they'll listen to them.
Yeah. The other, one more thing I just thought of. So employers are very competitive, right? So if you could provide examples of other employers and how they're investing in transportation or actively engaged in these transportation networks in a community, that becomes a competitive incentive for them to also to participate. That's what happened. We were working with a big manufacturing distribution plant in a rural part of Ohio, and there was another distribution plant not in the same industry and pretty close to where they were. And you know, we were saying, hey, look at this other company, look what they're doing, and they're investing in transportation. And sure enough, the company that we were working with jumped on board and started becoming very engaged in community transportation discussions.
Awesome. That's a really great point. I'm not seeing any more questions on the box, so I'm going to indulge myself since we have 8 minutes left. And I'm going to, you know, we had a pre-discussion amongst myself and the panelists and a few other folks, before last week. And here in North Minneapolis, one thing that's happening right now is there is a light rail transit extension called the Blue Line that was planned to go and now is not going to go on the existing route because there is a railroad that is not choosing to share what's called their right of way, which is the space next to their existing tracks. And so they're going to have to reconsider that route. Obviously, everyone knows that's a long process with planning and federal funding and alternatives analysis, et cetera. And one of I think the criticisms of the original route was that it really did go somewhat around North Minneapolis, and there were a lot of complaints that that they thought folks were potentially purposefully avoiding low-income African American communities with that route. So all that having been said, I'm curious, especially for Matt and Susan, about your thoughts about what communities can do to engage on long-term planning projects, because the immediate needs always have to be met, and I think those are always going to be critical. But I also think it's really important for communities to be more plugged into these long-term metropolitan and state transportation department initiatives, where they throw out documents like, "Hey, comment on our 5 or 20-year plan," And I always think it's an interesting challenge to think about how the everyday community member or someone who is a little bit more active even can engage in those processes.
So I will say a little bit, working with the MPO, It's different in each region how well an MPO is known by the community. But if you want to work with somebody directly that will make an impact on long-term transportation at a regional level, you need to work with your MPO. And I think it's also up to the MPO, and I think we try to improve on that all the time here, is to make sure that there's enough outreach that people are aware of what is going on. And not only that, with what we're doing at the regional level, we have such close connections with NDOT here in Indiana and KYTC, the Kentucky DOT, that if you want to know the long-term statewide projects too, working directly with the MPO in your region would be very helpful.
Awesome. I don't know if Susan's still around. She might have dropped off, but she's on vacation, so that's okay.
Yeah, I don't see her anymore.
I get back to vacation and the kids too.
Yeah.
Hey, Matt, this is Judy. Do you know if new projects in a community have to go under a Title VI review? Title VI, for those of you who don't know, is the equity metrics that FTA uses to assess new transit-oriented development kinds of projects. And I don't know enough about it. Matt, do you know?
I think it depends on the scale. There's always something that needs to be involved. I would assume something that what Jake is talking about would have to go through some kind of Title VI review, even if the Title VI review is a portion of the overall environmental review. Yeah, I would assume it would have to be.
There's another question came in from Brenda Richardson. She said, I'm in very rural Kentucky. I work with an organization providing opportunities in the arts to incarcerated and released people and people recovering from addiction. Transportation into and from rural communities for cultural opportunities is non-existent. Where do I start?
Well, and I would, finding out if you had mobility managers, these transportation coordinator people in your communities, contacting the Metropolitan Planning Organization or the Council of Governments. They're the transportation planners in communities, and doing an inventory. All those services that Matt described, the taxis, the human service organizations that might have a van that could be used to transport your folks. The other thing we found out is faith-based organizations in communities often have vehicles that are only used, a Friday, Saturday, and Sunday. And so potentially they could be used Monday through Thursday. There are school vehicles that potentially could be used when they're not transporting school kids. So I said this earlier, but rural communities are pretty entrepreneurial because they don't have a lot of infrastructure and fixed route. And often when people start thinking about all of the potential transportation providers in a community, they learn there's way more than they originally thought. There may not be a traditional bus like a METS or a HART, but there are smaller on-demand kind of transportation providers that could come together to ensure that everybody needs a ride.
And I'm not sure, Brenda would have to tell me where in Kentucky, if the area that she's in is covered by an MPO. If not, KYTC has a statewide transportation transit office that you could contact and see what they can tell you.
Okay.
Office of Transportation and Delivery, I think is what it's called out of KYTC.
So I think we're a minute or two out from the end here. There's one last question that I'm going to throw out, and then I think we'll wrap it. Tracy Nolan from Redbird Mission asks, where do we start to look for mobility managers? What types of agencies do they work at? I've never heard of these wonderful workers. I work in rural southeastern Kentucky.
So you could, and not all states and communities have the title of a mobility manager. Sometimes they're mobility coordinators, liaisons, but contact myself or Jerome, and we could hook you up with the person in your community that can help you identify these resources. Even the organizations that Matt mentioned, the COG and the MPO are good. They would know the inventory of services available in your community. There's also a regionally coordinated plan that includes all of the providers in the community. So a number of ways, but you could check our NCMM website first. and find out whether your state has a point of contact, whether Kentucky has a point of contact. You can contact, us directly, and then we'll connect you to the appropriate resources.
Sounds great. Hey, also, I want to, it looks like we're getting close to time. I want to thank the panelists, Judy, Matt, and Susan, wherever you are. I was joking a little bit earlier about people's bios, but it was more because, again, I have to read these really impressive and packed and stacked bios. But I always think it's really critical to know what people's backgrounds are, because I was like this quote from Steve Jobs that said, we don't have people around, smart people around, so we can tell them what to do. We have smart people around so they can tell us what to do. And I think that's really critical to these conversations with these folks who really drill down and know their subject area as well. I would suggest you tap them as resources. I'm assuming that's why they're here, sharing their contact info. And then Julius, I want to go ahead and give you the final word.
All right, thank you, Jake, for being our awesome moderator for our first session. And I really want to thank our panelists. You all were awesome and provided some very valuable information. And last, I want to thank everyone who participated and joined in. We hope that you are able to register and join other presentations. But thank you all. I hope everyone has a great rest of the day, and I even hope even more that maybe I'll see some of you at the next presentation.
Bye, everyone.
Have a
Thank
great
you.
day, everyone.
Thank you.